Hey all, thought I'd make a quick little video about some kind of work related things, I guess, but health related things. And just putting together sort of an idea in my mind based on some of the experiences that I have working with medical practitioners. Um, and just having surprising experiences in that area. A lot of them very good experiences. A lot of practitioners who are really interested in taking care of their patients, um, taking the risk of moving away from corporate models and even insurance based models and going into a more cash pay environment that gives them the freedom to treat patients the way they want to treat them instead of being kind of hamstrung or hogtied, um, with regard to what's allowable and what can be reimbursed. Now, that obviously can put some financial pressure on the patient, but it opens up possibilities um, that could mean healing and that could mean cures. So, we've been really fortunate to know quite a number of practitioners at this point who are of this mindset. I don't want to come across as being all or nothing when it comes to what people might call alternative healthcare, etc. I think there's a time and place for both of these models. One that is more corporatized, say hospital systems or networks of family practitioners, or family medicine that has multi-location, all the insurance reimbursement you can think of. There's a place for those things. Pharmaceutical versus nutraceutical. There's place for both, but I just think personally that the pharmaceuticals are exceptionally abused, overly prescribed to a really large extent, and then we've got this whole messed up pharmaceutical deal where a patient might have several practitioners, and she is being medicated from three or four different directions without anybody checking up. Now I'm talking about my own grandmother when I was talking about she being, uh, given these different meds. Well, family intervention in that case several years ago now has her off of all medications, and she'll be 96 years old in June. Um, anyway, I believe that healthcare um, is a different type of service. It's a different type of thing than just about anything else that we can buy or insure, or even be given as a gift. It sits uniquely in an area where costs can very quickly overwhelm and sort of contradict the overall purpose of offering it. I don't think it's always like that. I just think that it can be like that in cases where an individual, is financially overwhelmed, insurance reimbursement, insurance plans, or not. It's funny. I have a personal story about um, the delivery of a child where there was a family health insurance policy, but based on the rules at the time and the age of the policy, maternity coverage was not allowed. That was the state of Missouri several years ago. And then a relative who was having a child at the same time, same week, with full coverage, full maternity, and in the one case without the insurance, a cash pay arrangement was made with the hospital where the delivery took place, and the total cost was less than the total out of pocket cost for the other party who was having the other child. All right, that's kind of, I mean, that's just totally imbalanced. But it's true. I know because I lived it. Um, but in any case, where finances are concerned, I've I'm right at the infancy stage of this, but I put together a fund that can accept tax deductible donations for people who may have medical health care problems, maybe more predominantly based around brain and neurological health, just because that's the business that I'm in. Um, and so the fund is called Pathways, which is kind of, you know, um, maybe a double entendre. It's kind of focused on neurological pathways, but also pathways being solutions to problems, you know. And we've used this just a little bit. We've used this fund approach for a good friend recently in Kansas City. And overall, it went fine. Um, you know, whether or not a financial target is totally reached, I'm not personally overly concerned about that. I think the fact that we were able to raise a certain amount of dollars and put those toward treatment and rehab was a really great thing. So, yeah, I mean, kind of a crowdfunding approach, of course, but a unique fund that, you know, we're calling Pathways. And there's more to the name. I know there is, but for some reason, I just can't remember it right now. I'll maybe type it into the description. But my point is that I think we, as friends and as family, um, you know, we need to try to stick together. People can have health issues that maybe they prefer to be private. Totally understand that. But also, where there may be a real struggle for, you know, the financial side of healthcare, I think that we can create our own network of um, contributing in a tax deductible way to our own friends and family. That's not something that you just find anywhere, but it is, in fact, a completely legitimate and legal approach that we've taken with an outside organization that's got a pretty heightened specialty in this area. Um, I would like to know if anybody's interested in knowing more about this concept. If you've got loved ones, friends, family, even yourself, where um, healthcare concerns, especially costs and finances, are, you know, really a major concern, and that maybe some aid and some help is needed in that regard. You know, we live in really weird times, very, very expensive times, and healthcare is outlandishly priced. There's just nothing like it out there, you know, where you don't get to see the price until the service or the procedure is over. You know, those hospital charge masters that they keep hidden, along with all the codes that you don't get to see unless you ask to see them. You have to almost demand to see them. I've done that, where you can see the menu with the pricing before you order your dinner. But in most cases, the corporate side of healthcare will not provide those important details. So, anyway, if you or someone you know would like to learn more, talk more, maybe even participate in some way with what I'm putting together with my Pathways Fund, it definitely has worked. The concept is proven. Now it's just kind of a volume situation, right? How many people are out there who may need help? How many people are willing and wanting to help a family member, a friend, a loved one with a contribution to their much needed health care service or procedure or whatever it might be? And, you know, wouldn't mind getting a tax deduction for that. That can be done. I've got about 20 years of my career time in the nonprofit world. And so thankfully been able to use some of that in building this concept for my fund, which sits with a third party and is managed by a third party. And again, I can provide all those details, but give it some thought and roll it around if there's someone you know, or if you just think that this is an important issue and you'd like to know more or discuss more about it. I'd love to do that and try to help people I think we should be trying to help each other where we can on this very important issue where money can suddenly just become a tidal wave. And yet, people can be cured. They can be made whole again. And I think as a, community of family and friends, if we can do something, we ought to try. So share a comment or reach out to me anytime in the comment section, and I'll look forward to hearing, anything that anybody has about this, and we'll talk to you again soon. Bye.